In the name of God, we are beginning another part of the lesson. I speak about the clinical notes in the anterior abdominal wall. You can see here I speak about hemorrhage in the rectus. Now another shape you can see here. This is the here maybe in the anterior abdominal wall we have the maybe we have hemorrhage. You can see here better. Here you can see because maybe we have the weakness in the anterior abdominal wall, the small with the peritoneum come into the tip of the skin, and they removed the small removed. This is named hernia. Hernia means an organ removed from the normal position to abnormal position, like here. This hernia is because here we have the weakness in the anterior abdominal muscles. Here is xiphoid process. In inferior to xiphoid process, if we have a weakness, this is named epigastric hernia. This eminence is the hernial sac. In this sac we have coils of the small intestine. Maybe the small intestine come to superior to inguinal ligament. It is named inguinal hernia. Maybe a person has a surgical phenomenon in the abdomen. Here is cut by the surgeon and sutured here. After the surgery, here we have a weakness in the muscle, and from the incision we have the hernia. It is named incisional hernia. Or maybe here we have lateral border of the rectus. When here we have the name of this lateral border is named semilunar line. When we have hernia in the semilunar, here is named semilunar linea semilunaris. It is named Spigelian hernia. It is. And maybe we have hernia in the inferior to inguinal ligament. It is named femoral hernia. This hernia is for weakness in the anterior abdominal wall. But between this hernia, the inguinal is the inguinal hernia is very to than another, is many to than another. This is named, we have inguinal hernia in two kinds. One is indirect inguinal hernia, another is direct inguinal hernia. This is direct inguinal hernia. It is 15% in all of the hernia, within all of the hernia. When here we have a weakness in the muscle, the posterior wall of inguinal canal come to anterior, and here the small intestine come to the inguinal canal. Before I speak about this hernia, it is better you know what's the inguinal canal. Thus we're going to another shape for inguinal canal. Before we continue, we speak about inguinal canal. The inguinal canal is in the anteroinferior abdominal wall, because you know the gonad in the fetus is in the lumbar region in the fetus. Here is, you can see here is the anterior and anterior wall of the abdomen. Here is, there isn't my arrow, I am going for my arrow. Here we don't have any arrow. I am going for my it is my arrow. It is my arrow. Is my arrow. Here is the inguinal ligament. I told you here is the anterior wall of the abdomen. Here is inguinal ligament. I told you the gonad in the fetus are in the lumbar region. In the living of fetus, the gonads descending to inferiorly. The gonads passed between the anterior abdominal walls. In the female, the gonads is named ovary. Ovary come to the lesser pelvis. But in the men's, the testis, that is gonad, the testis come to the scrotum here. Here is scrotum come here. A part of the descending passageway for descending of the gonad is named inguinal canal. Thus, inguinal canal means a passageway for descending of the gonads in the females and men. Men's and women's twice have inguinal canal, but inguinal canal in the men's is large and inguinal canal in the women's is small. Thus the inguinal hernia in men are many and in women is less. Because the inguinal canal in the men are very large, but the inguinal canal in the female is small. Now, the inguinal canal has 4 walls. Anterior wall of the inguinal canal, the length of inguinal canal is 4 centimeters. The beginning is deep inguinal ring. Here is deep inguinal rings. Here is, and in the end is superficial inguinal ring. Here is superficial inguinal ring. I told you it has 4 walls. One wall is anterior wall, is from external aponeurosis of oblique extern. Thus, anterior wall of inguinal canal is external oblique aponeurosis. The floor of the canal is from inguinal ligament, and superior wall or roof is from arcuate fibers of the internal oblique and the transverse abdominis. Here is inguinal canal. This is inguinal ligament. In the superior part of medial half, here is inguinal canal. I show you another shape. This is superficial inguinal ring. This is end of the canal. This ring open to the scrotum. Here is inguinal ligament. It is floor of the canal. Here is the roof of canal. This is arcuate fibers of the internal oblique and transverse abdominis. We are going to another shape. It is deep inguinal ring. This deep inguinal ring is in the fascia transversalis. Here is ascis, anterior superior iliac spine, and superficial inguinal ring. This superficial inguinal ring has two crus. This is medial crus or superior crus. This is lateral crus or inferior crus. Between these two crus, it is superficial inguinal ring. Here is superficial inguinal ring. I am going to another shape for you. Here you can see better. This is the anterior wall of inguinal canal, and here is superficial inguinal ring. You can see here. Because this file is very long, I ended, and to the future file we continue. Thank you for your attention.